decades. Probably you can remember Aruna Shanbag case. We just Google it, Aruna Shanbag case, who dealt on the basis of that. We just revised the guidelines on euthanasia in our country Supreme Court guidelines. It was based upon the Aruna Shanbag case. So she was strangulated and sodomized in 1960s. She was a nurse in KM Hospital, Mumbai. Survived for 40 years, died 2013-14 or so. And then all these issues were discussed. So I was just referring that even she was strangulated, but she did not die. So now after 40 years, how will you correlate that she has actually died due to that incident? It becomes extremely, extremely difficult, as now you can understand. So that's why the cause of death determination is exhaustive exercise, and it is determined after sound evaluation of, I have mentioned first as a circumstantial evidence. Very, very important thing, circumstantial evidence. I have seen the police papers just written blank, just one request, nothing is supported, no inquest proceedings, no witnesses statement, no information, even not medical treatment papers are supported. Now they think that doctor is God or doctor is eyewitness. Whether just by seeing the dead body he will give everything. Not possible. Has to provide all the circumstantial evidence. And here again comes the difference between the basic functioning and the higher investigating authorities like CBI and all this. Because when they come to us after so many years, they have got each and every details of the circumstances, and that's why when we sort out the case for CBI, we have got so much information in comparison to the primary doctor who has conducted the autopsy, right? So we must understand that aspect also. Neither he is wrong nor others. Instead of, the idea is to just improve and to know the truth of that person. Ultimately, we are there, all of us are there for the investigation of truth, right? So ultimately, that has to be achieved. So circumstantial evidence, extremely important, which lacks in our circumstances many of the times. Evidence of disease and injury, laboratory studies, we are dependent upon the forensic scientists, different labs, different cases, different labs, chemical or toxicology examination, histopathologic examination. Many of the disease process, we need to supportive document, okay, that this particular disease has ultimately led to the death of the person, right? The ballistic examination, the biological examination, all the data recollected, then analyzed, only then the cause of death can be given in many of the situations. Sometimes it is very, very clear, very simple, obvious, everybody knows that, but sometimes it may be tricky and difficult, as now you can understand, right? I'll just skip that because of the paucity of time. Yes, hospitalized, the time since death, immediate the person has died, we can just comment upon. Even we know the time of the death, at that particular time and date the person has died. It doesn't create any problem. The problem happens when there is no information of when the person was last seen alive, in which condition the body was found. Now we have to analyze, now we have to comment upon the time since death. And that's one of the area where the scene of crime officers, police officers who goes to the scene first, they have got this, if they have got this knowledge to interpret what are these findings and how to interpret, it becomes extremely easy. And I can share now that Scotland police was routinely doing this. As soon as, because those are the persons, not the doctor who is conducting the autopsy. Doctor may conduct the autopsy after 12 hours, after 1 day, 2 days, 3 days. By the time all these findings are gone, intermixed, right? The person who is seeing first, he is the best person to interpret, to analyze those findings. And that's why I can vouch upon my dear friend Dr. Harsh Sharma, who has got a massive, you can say 3,000-4,000 crime scene visits, and he has got a fair bit of knowledge of this. And that's why he is treated as a god when we talk about the crime scene investigation, because he knows the intricacies. He can interpret that these are the findings. Because of that, he can say that this is the usual post-mortem interval, or this is the time since death when the body is recovered, and it can be learnt easily by others also. Changes in skin, changes in eyes. We can, anyone with a little bit of training can do. All the police person, and you'll be surprised to know, I have got one case from CBI, Andaman Nicobar. There, the police person who was the IO that has written the post-mortem interval findings, the postmortem, presence of postmortem staining over these areas in the inquest paper itself. And that gave us a lot of help when we were analyzing about the time since death. So I think there we need to understand, we need to advocate, we need to train all those persons involved. Our dear friends were discussing since morning that how to, you can say, train the judiciary, the police and all those. So I think these are the starting things what we can do, and I hope that NUJS Kolkata will take a lead in this particular region itself to train all those persons on these simple aspects which can easily be understood, easily be demonstrated, and then it can be incorporated in their practice as well. Right? Technovirus, simple thing. आई के नीचे इससे ही पता लग जाता है 3 to 4 hours person को death हुए हो चुका है. Small findings. Postmortem staining, we know how it happens. 6 hours. What is the time when it is fixed? Small informations, but it becomes very easy when we analyze, because afterwards when the body is shifted, transported, after that all that findings are gone. So it is the first investigation, first examination of the body which becomes important, and these things can be easily trained, easily shown, demonstrated to the police. And that's what you can say the idea of having all those training courses all over India, training institutes which we are doing that. Postmortem staining, right? Intricacies of that, where it is present. So to a lay person it looks like, oh, nothing, there is not much finding. But for us, when we see from the forensic eye, only this information can give a lot of information about whether the person was hanging and how much time he was hanging, what he was wearing, all those things. So it depends upon the knowledge when it is transformed, then it is of real value. If you are having knowledge, but if you are not applying in the real life situation, that also is of no use. So I think somehow we have to, you can say, adapt our practice. That is not only the theoretical knowledge, what we, of course, that's the first thing which we acquire during our studies. But then how to interpret in the real life scenario, that also is an art. And that's why the definition of forensic itself is start from the application of forensic, the knowledge, paramedical knowledge, science knowledge, whatever, for the purpose of administration of law. So it starts from application of whatever branch you can fit in, and last, purpose of administration of law. So those two are constant. You can fill in the blanks and you can define any branch of the forensics. Right? Rigor mortis, very simple. You can just demonstrate very easily. This you can say, putrefaction, if the body undergoes certain changes beyond 24 hours. All these things can be, you can say, trained and taught to the persons, and as a basic information. Because even as a forensic scientist, if you know all these things, when you analyze the postmortem report, because many of the times when you are actually into the field, you want to know what exactly the postmortem report means, because it helps you in your field of investigation as well, field of analysis as well, right? So certain basic things are required. I'm not going into the intricacies of that. How it is done, let's skip that. Just I already touched upon the what is there, where this lacuna and where which needs to be, you can say, improved, right? All those things. Because of the time factor, I'll be just skipping it. Autopsies, what we do, we open all those 3 body cavities, the chest, the head, the cranial cavity, the chest and abdomen. That's the literal meaning of autopsy, opening all 3 body cavities. In our scenario, of course, the COVID practice has changed. It's changing depending upon case to case. But by and large, still, autopsy means opening all 3 body cavities, right? All 3 body cavities needs to be opened. Everything needs to be examined. And we talk about these various cases of the toxicological examination. Now here comes the intricate role of the toxicologist and the, you can say, the doctors, right? So how much which organ is to be preserved, how much is to be preserved, in which manner is to be preserved, so many intricacies upon that. The guidelines say something else. They were drafted 40, 50 years ago. Now the times have changed. Sophisticated machines we are having. So what is the scenario? What is the current, you can say, the gap where we need to fulfill all those things. So there, we need to have a dialogue between, suppose it says the blood used to be preserved at 100 ml. But in current scenario, 10 ml is more than enough. We have got the whole change scenario of these things. But then again, there is a, you can say, total disconnection between forensic medicine, or I should say the medical domain, and the forensics domain, barring few of the places, or barring few of the persons who are, you can say, on the one-to-one basis just due to their personal associations they are having. Otherwise, by and large, the system, there is total communication gap between these. So forensic scientist does not know what the doctor is sending, and the doctor does not know what the forensic toxicologist requires, right? Over a passage of time, we need to examine that, we need to change that, update that. Injection poisoning, gaseous poisoning, poor doctor most of the times. Doctor, I mean, I'm telling you again, it's a very different, you can say, discussion point, because 80 to 85% only MBBS doctor are doing the autopsies, and that's another reason why our system is so much poor. Only 15 to 20% cases in the metro cities, the autopsies are being conducted by the trained persons. 80% it is the usual MBBS doctor who doesn't have that kind of expertise, knowledge, what is supposed to be. So we are advocating to change that practice at the level of NMC also, National Medical Council also. Right? How it is changed and all, okay, that's a different scenario. But then I'm just telling you, these are the domains which are interdisciplinary, fall under both. Blood, the serology and biology experts come into picture, how it is to be done, right? What is the interpretation of that? How many, what manner the gauze, blood in gauze has to be preserved. I have seen just collecting the blood or whatever is being spilled over, or for that matter, just puts down in the thoracic cavity, just takes the blood and preserves it. Is this the correct manner of preservation? Probably no. So we need, unless and until we understand the serologist, biologist interacts with the you can say forensic medicine persons, or for that matter medical persons, only then things can be sorted out. That yes, our lab needs this kind of preservative or in this manner, so that the doctors can be trained. So it's a mutual thing, right? All those things we need to have. The weapon examination, it goes to the forensic fingerprint expert. Bullets, I already taught to you, right? And then yes, of course, article, typical issues, more complicated issues where we need to understand the role of so many persons involved in that chain. Yes, so I'll be just hurriedly come through the other branches of forensic medicine which have got the specialized role, right? You can say the forensic anthropology. I already touched that with the knowledge of examination of bones. Till the time I didn't go to the Scotland in 2015, I was thinking myself as a very good expert that yes, I have been exposed and I am sitting at the topmost institute of India, and I have handled Nithari case and that case, those case, and I am a very good forensic anthropologist. But when I went to Scotland, I learned so many things, intricacies of the core domain of forensic anthropology, which I was not aware. We was thinking that whatever we are doing is right. But when you go, when you interact with the other persons who are really into that, then you understand where you actually stand in that particular field. So my other fellowship, second fellowship, gave me a chance to just learn through all those techniques for the benefit of us. And it was just you can say all these things, I was not aware that, okay, we are just thinking upon the x-ray is more than enough. Just based upon that, we can just interpret, okay, itna ho gaya to ye age aa gaya, itna ho gaya to ye age aa gaya. All those things, right? Pure, when you go into the details of that, you feel, you understand that how much novice you are in that particular field, right? So one should never stop learning. That's one message for the students as well. Don't think yourself that you know each and everything. There is no age for learning. There is no time for learning. Continue to do that. Forensic odontology, knowledge of dentistry helps to us in so many investigation of cases, right? Living beings, the dead bodies, all those, right? Lip prints, all these are advances. Where the role of forensic science, I can see the forensic odontology courses are being run by the National Forensic Science Universities, Gujarat. So why cannot the NUJS, Kolkata, can start that case, that syllabus here also in due course of time? Because there is a whole dearth of these experts in our setup, right? Unless and until we have those kind of expertise, the manpower, only then the government policy changes, right? That's you can say, a very tricky scenario, because the government also always says, no, there is no experts in these area, so why to change the policy? So we advocate, no, please change the policy till the time. One, it cannot be filled in 1 day, 2 day. It's a long process. It takes years to develop any system, right? So all these things we need to understand. We need to disseminate this kind of information to all the persons who are concerned with that. The bite marks, it gives so much information. Just examination of the bite mark, we can have so much information. The saliva, the DNA, all these comes from there only. If it's a case of child abuse, right? How to take bite mark in a proper manner, how to take swabs from that bite mark. That is also, if you don't know how to take swabs in a proper manner and it is contaminated, the DNA expert is failed, because he cannot distinguish. So all these, we need a collaboration between all those, right? So first we need to understand the intricacies, the role, and then the collaboration, right? So that is the, you can say, one of the branches of forensic. It's all interdisciplinary, or you can say it's neither, it falls every domain. The dentist also can do, the doctor also can do, and that's why, that's how our system governs. When we talk about the examination on the dead body, it is only the doctor, as per our criminal procedure code goes. Only doctor can touch the human body, nobody else. So ultimately he has to learn also. But then there is no harm in having a team of persons from the concerned field. That concept needs to be changed, right? At my institute, I have got the liberty, we have got the liberty to include whosoever we want. That's autonomous institute. We can place the policy for the whole country. But scenario is not like that in the different parts of the country. India is a huge country. It's not country, it's a continent basically. If you go one state to other state, the whole practice of even simple things changes. The viscera preservation, the pattern of reporting of this toxicology report. I have seen at least the toxicology report from the, I can say, 25 to 30 states of India. I have got a collection of that. And there is a huge variation even in the pattern of reporting as well. So when we talk about the uniformity, expertise, so many things, so many intricacies come into picture. Because of the paucity of time, I think I'll just have to skip so many shares. Just Sheena Bora case, as I told you, it was not only the highest, and that was, I was lucky to have, as soon as I returned from the Scotland in 2016, the CBI referred the Sheena Bora case to us. Only skeletonized bodies were recovered, 3-year-old, and you know, and we analyzed each and everything, right from the determination of sex, age, everything, and then the personal effects. So we could see and we could pinpoint that yes, the feelings, the patterns, the knowledge of forensic dentistry, knowledge of forensic anthropology, everything was placed into this. Everything was applied into this real life scenario, right? So all these things we need to understand how much information we can gather from a particular, you can say, the case scenario, depending upon this case to case. Yeah, we know that how much, so many times the issue of age determination comes, and again there is a role of anthropology, dentistry and radiology, all those interdisciplinary branches, right? So many times just by examining we can say what is happening. Mass disaster scenario is one where there is a need of all the persons, all the branches of forensic scientists when we talk about the disaster victim identification or mass disaster. So it's not only the doctor, the anthropologist, the crime scene officers, the DNA experts, the dentist, the radiologist, right, technicians, everyone is involved in that team when we talk about the investigation of a mass disaster, which is the best source of DNA. We say that it's a second molar, right, because of certain things, right? But whatever is available, blood is available, okay, that is best. Tissue is available, okay, that is best. Corona times, when people were afraid to open or touch the body, we revised the policy and scalp hair, 200 strands of scalp hair with intact root, the DNA can be isolated. So many issues were there. So as our system grows, we have to revise, we have to change our practices as well. We have to be thinking of the times which we are going and having a pace with the advancement. That's the, you can say, one of the things which we need to keep in mind. Don't go by the whatever is conventional, whatever is written 150 years ago or 100 years ago. In today's date, that is outdated. So we need to understand that. How we can apply that technology for the benefit, that's we have to incorporate as a technical expert. So how these concepts of autopsy or the digital autopsy, how without opening the dead body, if the internal findings can be documented, and that's the, you can say, need of our, so many times the relatives and everyone request, please डॉक्टर साहब बॉडी कम खोलिएगा, बॉडी मत खोलिएगा, ऐसे ही दे दीजिए. All these type of request we get, right? But if we do that, everybody is happy, whole body is intact, and we are documenting the internal findings. But then whether the law, legal luminaries, law experts, or the judiciary will accept this kind of evidence, again, there comes interdisciplinary. We need to have the persons on board, which I am happy to see that because it's a University of Juridical Sciences Law, the persons are there already on the board. So they can understand what is there, what are the changes in various IT Act, 65 IT Act, whether it can be applied over here, Indian Evidence Act, whether it can be applied in this scenario, this kind of documentary evidence will be treated as final or accepted as such or not, right? So all these, you can say, radiology is very much useful when we talk about the firearm injury cases, location of the bullet, where it is there, documentation, location, everything, right? So it's a multidisciplinary thing. This is a case of Chandigarh itself, reconstruction of scene, right? So 2 bullets and two firearms, one side, other person. So many times we need the persons of the, you can say, the other persons, other experts from that who can, you can say, complement or supplement the investigation process. So we need to understand that also, along with the technology and all. So many times we have applied, we have used, you can say, as a team when we have worked, and we could sort it out so many things. Within few minutes I'll be just finishing. I hope I'm spot on time. So this was one very famous case, Badaयूं case, happened 8 years ago, and in whole world, you can say our country's image was tarnished, and it was shown in the media that 2 girls, young girls, they were brutally raped and murdered, and they were hanged on a mango tree, right? So ultimately the case was transferred to CBI. I was the chairperson of the board, and then when we analyzed each and everything, went to the scene of crime with the whole team of the forensic science experts from the CFSL, from the CBI, which we analyzed what was the condition of the body from which we are hanging, what was the height, whether it is possible or not, what was everything, we could sort it out that no. And after analysis of hundreds of evidences and cross questions, analysis, interaction with the doctors, scientists, whosoever was part of that, we could say that it was a case of hanging, right? So it was not a case of homicide, it was a case of suicidal hanging, and it was not a rape. In fact, one girl was menstruating in the menstrual phase, which because of the persistent hanging in a prolonged condition for 6 hours or more, the blood trickled from her private wards, which the poor doctor interpreted as an assault, right? And the whole case went in other direction, right? So we need to understand all these intricacies. When we work in a team, then we could actually, you can say, analyze, actually understand how much the help one can provide. So for the best result, when we talk about the criminal investigation system, or for that matter, commensurating with the central theme of the, you can say, this first seminar, the best approach will be to have a multidisciplinary approach, where a team of the, you can say, the persons from different streams, like forensic medicine experts, ideally, forensic scientists, again forensic scientists also from different streams, right? The dentist, radiologist, depending upon case to case, it may not be in all the cases, but that is required when we're talking about the best result, right? So with this, I would say that I can see there are a whole lot of students over here, and of course they will be thinking of having more and more knowledge of forensic medicine, probably because they are never exposed to that kind of knowledge. And that course was missing because it's a medical domain, so the knowledge is confined to the doctors. It is not, you can say, disseminated to the police persons, to the forensic scientists. Considering this, the government of India in 2016 requested me to develop some course on this for the UG PG teaching, right? Under the Swayam platform, under the EPG Pathshala uh, program, and we developed the massive open online course for 3 courses. They gave me this opportunity to forensic medicine, forensic anthropology, forensic serology and biology, right? Ultimately it was gazetted also. There were apprehensions that online ये teaching हो जाएगा तो जो teachers को apprehension था नहीं हमारा खत्म हो जाएगा काम, ये तो सब कुछ online ही हो जाएगा, फिर teachers की क्या जरूरत है, all these things. Anyway, gazette notification was there, UGC circular was there that 20% of the weightage can be given to the online teaching method also. That happened in 2016. And now you can imagine, we have never thought that something like COVID will come. And since last 2 years, everything is going online only. So forget about 10 to 20% weightage, it's 100% online teaching what we are having since last 2 years or more, right? So this project was there, it was allied, and I developed this over a period of 2 years, all these efforts. And now after these efforts of so many years, now the government has made it free on the Vidya Mitra YouTube channel. One of the channel is a Vidya Mitra. If you just search on the YouTube, just go to the Vidya Mitra and just search any type, any keyword like forensic medicine, and you want to know about the injuries, you want to know about the hanging, you want to know about the strangulation, more and more. So I have made 30 to 35 minutes of lecture incorporating various pictorial representations and all those, so that people can have an in-depth knowledge of that. And it is open for all, free for all. The people all over the world are, you can say, learning from this. 2019, I went to Dhaka, Bangladesh. As soon as I went there, so there were student volunteers, usually like here. I was happy to see so many volunteers greeting from us when I just entered from the hall. There also, same thing happened. And I was astonished. In that country, Bangladesh, where we know the higher persons and all, why the students are coming to us, flocking me together, taking photographs. And then they said, sir, we are learning through YouTube videos, all the intricacies of forensic, all their medical students and all. So that gave me an entirely different kind of feeling that yes, I could fulfill, I could disseminate some kind of information to the fraternity which is available now. So that's my passion. I just do it on my own, and I would say that instead of wasting your time on these various chit chats, WhatsApp, YouTubes, seeing other kind of videos and all, you can utilize your time in best manner by learning through these videos. 30 to 35 minutes, whenever you can spare time, whenever you want to learn, just type few keywords, my name, forensic medicine, and the topic. So many videos will come up, and then you can just learn. It will be easy, and that's the whole purpose, to disseminate this information for all who actually are not exposed. Medical doctors, of course, are exposed a little bit, but they also learned through this video. So thank you for your patient listening and giving me this opportunity. I hope I am just finished within 1 hour, maybe 1-2 minutes little ahead, beyond my schedule. And I'll be happy to take the question answers right now also, or if the organizers don't permit at this time, maybe during lunch time or afterwards. I hope I have not bored you much. I understand this it looks little bit of, you can say, when we're talking about the pure forensic sciences, then it looks like, but then I think now you can understand how much we need the collaboration between all of us, between these two branches. Unless and until we understand each other, we are not going to, you can say, improve upon much, and the system is not going to improve.